Push hard. Really hard push here. We're stepping again. Look down. Veronica. Veronica. Grab your daughter.
We just made it through the hardest part, and you were inside of me for 9 months, and here you are. You just can't wait to start your journey.
Congratulations on the birth of your baby. Like most new parents, you probably have a lot of questions. The more you can learn about caring for your newborn and yourself, the more confident you'll feel. So in this program, we'll cover some basic information that will help boost your confidence and get you through these first couple weeks.
You're doing a great job. Hi, I'm Rachel. I'm a nurse who works with new parents, so I understand how having a newborn can feel a little overwhelming. Throughout this program, I'll share some important information to make your transition from hospital to home a smooth one. At the end of each chapter, we'll do a quick recap of things to take a little more seriously and when you should call your healthcare provider.
After giving birth, I spent 2 days in the hospital. And so the 2 days really allowed me to cater to the baby, and, you know, they're just so delicate.
You're finally meeting your baby. Who is this little person? Getting to know her isn't hard, just spend time together. In this chapter, we'll cover the essentials of caring for your baby and some important warning signs to watch for in the first couple weeks. Eat, sleep, pee, poop, and repeat. That's what babies do. In fact, you've probably heard that you're going to be changing a lot of diapers. It's true. Think of it as a time to bond with your baby. Don't worry if your baby cries during his first few diaper changes. He'll eventually get used to it. They may be tiny, but babies can move suddenly. So always keep one hand on her when she's on a high surface, and use the safety strap on your changing table. Clean in the folds of skin really well and wipe from front to back using a clean part of the washcloth or a new wipe each time. If she gets a rash, change her diaper often. Expose her bottom to fresh air for a few minutes and apply some diaper rash ointment. If the rash gets worse or doesn't go away after a day or two, let your baby's healthcare provider know. Also, don't forget to wash your hands after every diaper change and before feedings. By the way, the American Academy of Pediatrics recommends never using baby powder. It can cause breathing problems and serious lung damage if your baby inhales it.
Baby stools, you know, initially they come out, it's like black. And then about 2 days, when your milk comes in, if you're nursing, breastfeeding, then it starts to change and look completely yellow. Yellow, brownish, and a little bumpy.
Your baby's stools will change over the first week. A breastfed baby's first stools, called meconium, will be black and sticky. From day 3 to 4, her stool will change to a greenish-brown color. Then from day 5 to 6, it will be yellow with a loose, seedy texture. By day 5, a breastfed baby should have at least 4 stools every day. It helps to count wet diapers too. On the first day, he should have at least 1 wet diaper, on the second day 2, and on the third day 3. By the 4th day, after full milk production begins, he should have at least 5 diapers. On the 5th day and beyond, he should have at least 6 or more very wet diapers with pale-colored urine every day. If this isn't the case, call your baby's healthcare provider. It could be a sign of dehydration. Don't be surprised if you end up going through 10 to 12 diapers a day for a while. To help you keep track of all your baby's wet and dirty diapers, you can log them on paper or use an app on your phone. If you had a boy and he was circumcised, all those diaper changes are the perfect time to make sure his circumcision area is healing well. If you haven't yet made a decision on whether or not to have your son circumcised, it's good to know that the American Academy of Pediatrics says that while there are some health benefits to circumcision, it's not enough to recommend that all babies need to be circumcised. The decision is still yours, based on your religious, ethical, and cultural beliefs. Caring for your baby's circumcision is easy. Follow your healthcare provider's instructions and keep the area clean and dry. The thin yellow crust that forms around the circumcision is part of the healing process, so don't pick at it. If your son isn't circumcised, his penis doesn't need any special care. Just keep it clean and don't force back the foreskin. It retracts on its own as he gets older. Also, while you're changing those diapers, check your baby's umbilical cord stump. Keep it clean and dry, and fold the diaper down so it doesn't irritate the stump. In a week or so, it will fall off on its own. There may be a little blood, but that's normal.
When taking care of your baby's circumcision area and umbilical cord stump, it's good to be on the lookout for signs of infection, such as a thick green discharge, swelling, redness, and a foul odor coming from the area. If you see any of these things, you should contact your baby's healthcare provider. They're healing nicely, just keep them clean and dry.
Another thing to watch for is jaundice. This is when some newborns develop a yellowish color in their skin and eyes because there is a buildup of bilirubin, a pigment in the blood. Your baby's body gets rid of bilirubin through her stools and urine, so feeding her frequently helps. Your baby will be checked for jaundice while you're in the hospital and at her first well baby visit. Speaking of well baby visits, make sure you go to each appointment. These visits are important for tracking your baby's growth and development, getting her vaccinated to protect her from illnesses, and they're the perfect time to ask questions. Your first well baby visit is typically within a few days of being discharged from the hospital.
I try to help my wife out a lot during our well baby checkups by opening doors for her, carrying the car seat into the building for her, and during the checkup, just holding the baby, taking care of the baby as she meets with the doctor and asks him questions.
His vitals look great. Babies get sick easily because their new immune system isn't quite ready to fight germs. So, don't hesitate to call your baby's doctor between those well baby visits if your newborn seems lethargic or unusually sleepy, is not eating, or if you sense that something is wrong. He's a healthy boy.
Keep your baby healthy by washing your hands often and asking others to do the same.
Can I hold her?
Of course, but can you wash your hands first, please?
Of course.
Especially after being in public places. If someone is sick, don't let them hold or get too close to your newborn.
There you go.
If you think your baby is sick and you need to take his temperature, you can do it under his arm, or ask your baby's healthcare provider how they recommend you take his temperature. Also, find out at what temperature you should call or visit the office. Many new parents look forward to giving their baby her first bath. In the first few days, a sponge bath is all your baby really needs. Lay her on any safe, flat surface and always keep your hand on her. Wash her face with a clean washcloth and her eyes with a clean cloth from the inside corner to the outside, using a different part of the cloth for the other eye. Then clean her neck, ears, and hands, paying special attention to all the folds and creases. As you clean her, keep her wrapped in a towel so she stays warm. When it comes to your baby's first tub bath, follow your healthcare provider's recommendations. To keep your baby as safe as possible, put him in a properly installed rear-facing car seat every time you get in the car. A recent study showed that the majority of new parents don't install their car seats correctly, so it's important to make sure you do it right. You can find a car seat inspection station near you by visiting safercar.gov. Using a car seat is the law, and it starts with your trip home from the hospital. Babies often fall asleep while in the car, and while it may be tempting to take advantage of this and let your baby stay sleeping in her car seat, the best thing to do is to move her into her crib as soon as you get inside. It's not safe to leave your baby in a car seat for an extended period of time.
I want to stress how easy it can be to accidentally leave a baby in the car, especially if you're tired or you're not used to your new routine. Never leave your baby alone in the car, not even for a minute. The inside of a car can reach dangerous temperatures quickly and cause heat stroke, which can be fatal to babies. It might sound obvious, but I recommend putting your phone and your purse in the back seat to remind you to always take your baby out of the car with you.
There are a few other things to think about when it comes to safety. While it's rare, you've probably heard of SIDS, or sudden infant death syndrome. It's a scary topic for new parents, but there are things you can do to reduce your baby's risk of this and other sleep-related deaths. Most importantly, always put your baby to sleep on her back on a firm mattress in a safe crib or bassinet, and in the same room as you, but not in the same bed. Keep all items out of your baby's crib, including pillows, blankets, bumper pads, and toys that could cause suffocation. You can use sleep sacks or sleepers instead of blankets to keep him warm. Never put him to sleep on any soft surfaces, like sofas, chairs, beds, or a breastfeeding pillow. Room share with your baby for at least the first 6 months, and ideally for the first year of life. Also, breastfeed your baby as much and for as long as possible. If you think that there's even the slightest possibility that you may fall asleep, push your pillows and blankets away and don't breastfeed your baby on a sofa or cushioned chair. Also, make sure you keep your home and car smoke-free. And finally, since overheating is associated with SIDS, once you are discharged from the hospital, don't put a hat on your baby while he's sleeping, and keep the room around 70 degrees.
Well, she cries, but not really like a major cry, just kind of like squeaking when she's hungry. And so that's kind of a good indicator it's time to feed. She cries when we're changing her diaper and putting wet, cold baby wipes to clean her up.
All babies cry when they're uncomfortable or need something. When you respond to his cries right away, you'll learn about meeting his needs. And he learns to trust you, which leads to less crying later. No matter what anyone tells you, you can't spoil a baby. It helps to think through a list of reasons of why your baby might be crying. Maybe she has a dirty diaper, or perhaps she's tired. Maybe you missed the earlier signs of being hungry. Is she overstimulated and needs quiet? Or maybe she just wants to be held.
A crying baby can be stressful for tired parents. If you ever feel like you are losing control, put your baby down in his crib for a few minutes until you calm down. Never shake or toss your baby. It could cause brain injury, blindness, or even death.
So like the other day, he cried when he heard Dad's voice and he wouldn't stop crying. So I told her, I was like, well, maybe he just wants to come hang out with Dad. And sure enough, that's what he wanted. So as soon as he was in my arms, he was done crying.
That was a lot of information to cover. So when you get home from the hospital, just keep an eye on these things. Let your baby's healthcare provider know if you see any signs of infection around your baby's umbilical cord stump or circumcision area. Also, call if your baby has diarrhea, if he has white stools or hard stools that look like pebbles. Be on the lookout for signs of dehydration, such as not enough wet and dirty diapers, dark yellow urine, or a dry lips or mouth. Call if your baby has a fever of 100.4 degrees Fahrenheit or above. Also call if your baby shows signs of jaundice, is lethargic, if your baby is coughing a lot, not eating well, or if he is projectile vomiting, which is more forceful than spitting up. Finally, go to your closest ER or call 911, whichever is faster, if your newborn's lips, tongue, or mouth are turning blue, or if he is having difficulty breathing.
There is a bond with breastfeeding, and I would wish every mom could breastfeed because it's such an amazing bond.
You probably already know that breastfeeding is the ideal way to feed your baby, for his health and yours. Plus, breastfeeding helps you and your baby bond. In this chapter, you'll learn how to get breastfeeding off to the best start. It can take a couple of weeks to get the hang of breastfeeding, so be patient and get all the education and support you can from the hospital nurses and certified lactation consultants. You can also contact a local breastfeeding support group. Many early breastfeeding challenges are easily solved when you get help right away. During the first few hours after giving birth, hold your baby skin to skin often with no blankets or clothes between you. Skin to skin contact regulates his temperature, breathing, and blood sugar levels, and helps your baby latch on better and breastfeed longer. Continue skin to skin at home, too. Be careful while holding your baby skin to skin. Make sure her head is turned so she's able to breathe easily. If you find yourself falling asleep due to exhaustion or from medication, you could accidentally drop her from the bed, so ask your partner to hold her or place her in the bassinet while you get some rest. During pregnancy, your breasts have been making colostrum, a thick first milk for newborns. Then, around 3 to 5 days after birth, your colostrum changes to mature milk, which is more plentiful and not as thick as colostrum.
The more milk your baby takes, the more you'll make. So, to establish your milk supply, breastfeed whenever you see his hunger cues, which should be about 8 to 12 times every 24 hours, and feed him for as long as he wants. That's a great latch. You're doing great.
Watch your baby, not the clock, to know when to feed him. This helps you recognize and respond to his hunger cues. A hungry baby opens his mouth, sticks his tongue out, makes sucking movements or sounds, brings her hand to her mouth, moves his arms and legs as though he was crawling, and turns toward your breast. Try to respond to these early cues before she starts to cry. It's a lot harder to feed a fussy baby. Your newborn's tummy is small, and it empties quickly. That's why he needs to breastfeed often, both day and night. If he's sleepy and not eating at least 8 times in 24 hours, you'll need to wake him up to eat. When you breastfeed, you'll want to make sure your baby has a deep latch. To do this, hold him tummy to tummy with his nose across from your nipple. Tickle your baby's mouth with your nipple until he opens his mouth wide. Pull him in quick and close to your body so he takes in as much breast as possible. If you need to relatch, just gently break the suction and try again. A deep latch allows your baby to breastfeed more effectively and protects your nipples from soreness. Breastfeeding shouldn't be painful, but you may feel a little soreness when your baby first latches on. If you have a deep latch, this tenderness should only last for a few seconds. If it lasts longer than that, get help from a certified lactation consultant or talk to your healthcare provider. Sore nipples are often the result of a poor latch, so make sure your baby is latched on correctly every time you feed. Let your baby feed as long as he wants from the first breast. When he slows down, you can try to burp him for a few minutes by holding him upright and gently patting his back. Then offer the second breast, which he may or may not take. Breastfeed from both breasts to encourage good milk production. You know your baby is getting enough breast milk if you can see and hear him sucking and actively swallowing during a feeding. After a feeding, he should seem satisfied, and your breast should feel softer.
In the first week, it's normal for your breasts to become heavier and fuller as your body starts making more milk. But excessive breast swelling, known as engorgement, can be uncomfortable for you and make it difficult for your baby to latch on. Feeding your baby often is the best way to avoid this. Here, this will probably help.
Soften your engorged breasts before a feeding by applying warm washcloths, massaging your breasts, or expressing some milk. You can also apply ice or a bag of frozen peas to reduce swelling. If your breasts still feel full after a feeding, remove some milk with a pump or by hand. Engorgement can lead to mastitis, which is a painful breast infection. Signs of mastitis include having a painful breast with a red tender area, along with flu-like symptoms, such as a fever or aches and pains. Keep breastfeeding and call your healthcare provider right away if you suspect you have mastitis.
The best way that I can be there for Darcy when she's breastfeeding is just to be her emotional support and to keep her from getting frustrated and keep things positive.
Wait until breastfeeding is going well, usually about 3 to 4 weeks before offering your baby an artificial nipple like a bottle or pacifier. And unless your doctor prescribes it, don't give your baby water, formula, or anything else. Your milk has everything he needs. One more thing to keep in mind if you're breastfeeding is to call your healthcare provider first if you need to take any kind of medication, over-the-counter or prescription.
I'm currently breastfeeding, and I was wondering if it was safe to take one of my prescriptions.
That's a lot to remember about feeding your baby, so here's a quick review. Call your baby's healthcare provider if your baby has fewer than 4 dirty and 6 wet diapers each day by day 5, is not feeding at least 8 times in a 24-hour period, needs to be woken up often for feedings, or isn't waking up at night to feed. Call your healthcare provider if you have any signs of mastitis, such as a red, tender area on the breast or a fever. And be sure to get help from a certified lactation consultant if you are having any trouble with latching your baby on or if your nipples are visibly damaged.
I think that's the great thing about breastfeeding and nursing is that you're, reminded just from the baby, like I gotta make sure I'm eating the right foods. I have to make sure that I'm drinking enough water. And so they help you self-care.
It's normal to want to focus on your baby, but you need nurturing too. In this chapter, we'll cover what you need to know about taking care of you so you can care for your baby. In the first few days after birth, your uterus will begin the process of involution. This is when it shrinks down to its pre-pregnancy size. With involution, you may have mild contractions called afterpains. Afterpains can feel stronger while you're breastfeeding because breastfeeding helps the involution process. Afterpains may be a little uncomfortable at first, but they'll lighten up in a few days. As your uterus shrinks, it discharges blood and tissue called lochia, which is different than your period. The lochia will be bright red after birth. Then it starts to decrease and change in color from red to brown to white. Keep in mind that it's normal for lochia to get a bit heavier while you breastfeed. It can also increase if you're not resting enough, so listen to your body and take it easy in those first few days. To reduce the risk of uterine and vaginal infection during this time, don't use pools and hot tubs. Wear pads instead of tampons, and avoid douching.
When your menstrual cycle starts again, it might take a few months for it to get back to normal. Don't be surprised if it's heavier, lighter, longer, or shorter than it was before you got pregnant. Also, it's important to remember that as your body returns to its pre-pregnancy state, you might start ovulating as soon as 2 weeks after giving birth and could get pregnant again, even if you are breastfeeding and before getting your period. So plan accordingly and discuss your options with your healthcare provider at your 6-week postpartum checkup. You're gonna need these.
If you delivered vaginally, your perineum, the skin between your vagina and anus, is probably sore. Here are a few tips to help relieve some of the soreness. To reduce the sting as you urinate, squirt warm water on the area using the peri bottle your hospital gives you. Also, avoid sitting for long periods of time in the first week. You can use an ice pack to ease the pain. And if recommended by your healthcare provider, you can use sitz baths, either with a plastic tub that fits on your toilet or in a clean bathtub with shallow water. Use warm water to soothe soreness and cold water to help reduce swelling.
Do Kegel exercises regularly to strengthen your pelvic floor muscles and relieve discomfort. They're easy to do, and while it may sound silly, I tell my patients to do them while they're breastfeeding or sitting at a traffic light. Trust me, it's worth taking the time to do them. Are you doing your Kegel exercises?
Another common occurrence after childbirth are hemorrhoids. Keep in mind that constipation can make hemorrhoids worse, so eat lots of fruits, veggies, and whole grains, and drink plenty of water. If your bowel movements are especially painful, your healthcare provider may send you home from the hospital with a stool softener. Even though your perineum is still sore, don't resist the urge to go to the bathroom. Try to take a few short walks around the hospital and when you get home. Call your healthcare provider if constipation remains a problem.
Hey, you. All right, go ahead and lay down. Take it easy, okay?
For those of you who have had a cesarean birth, you need to remember that you just had major surgery, so take it slow. Follow your healthcare provider's instructions about driving, using stairs, and physical activity. Avoid lifting anything heavier than your baby. Call your doctor if you have worsening pain around your incision or increased swelling or drainage from your stitches, or if you have a red, tender area on your arm or leg. This could be a blood clot, which is common after surgeries. After birth, both vaginal and cesarean, you may feel a little sad. The baby blues happens when your hormones make you feel overwhelmed, weepy, and irritable. Just know that the baby blues are normal and should pass within a few weeks.
After we came home with the baby, Amy's been crying a little bit, and it's completely normal and expected to have those emotions. And so we're just keeping an eye on it, and we'll call the doctor if it looks out of the ordinary or keeps up.
For some moms, more serious mood disorders can occur, including postpartum depression. You can experience this anytime within the first year after birth. If you have a history of depression or anxiety, you have a greater chance of developing a postpartum mood disorder. Since it's caused by a change in brain chemistry, postpartum mood disorders need to be treated by a professional, with therapy and medication. Remember, postpartum depression is not your fault. Many new moms experience it, and it's okay to ask for help.
Many new moms ask me how they'll know if it is time to call their healthcare provider about how they are feeling. I tell them this: if your symptoms are interfering with your daily activities, disrupting your ability to sleep or eat, or if you are feeling hopeless or helpless, then it is time to get help.
Becoming a new parent can be stressful. To help you cope, rest whenever the baby is sleeping, eat a healthy diet, and squeeze in a little physical activity when you can. It's amazing what a walk can do for your mood. Talk to your healthcare provider about when to start exercising and what is safe. Also, it helps to keep life simple as you adjust to all the changes. Keep your baby close by and in the same room as you. Set up a second diaper changing station in the living room. And keep healthy one-handed snacks around so you can eat while you breastfeed.
Thanks. You're welcome.
I really think I need to take a shower. Do you mind?
Finally, ask your friends and family for help when you need it, even if it's just to take a shower or a nap.
Remember, it's important to take care of yourself so that you can care for your baby. Call your doctor if your lochia saturates 1 pad or more in an hour, if you have sudden heavy bleeding or vaginal bleeding with a foul smell, if you pass frequent blood clots or have blood clots larger than a ping pong ball. And call your healthcare provider if you have worsening abdominal pain or dizziness with increased bleeding. Also, call if you are constipated for more than a few days, or if you have pain or burning with urination that's accompanied by a fever. It could be a urinary tract infection. You should always call your healthcare provider if you have a fever of 100.4 degrees Fahrenheit or above. A fever means your body is fighting an infection and you may need antibiotics to treat it. Feeling a little sad after giving birth is normal, but get help right away if you see signs of a postpartum mood disorder. Constant crying or worrying, not finding pleasure in things you used to enjoy, problems eating or sleeping, irritability, difficulty concentrating, are unable to care for yourself or your baby, have thoughts of harming yourself or your baby, or thoughts of suicide. Go to the ER or call 911 right away if you are having hallucinations or are scared you will harm yourself or your baby. Also, while it's rare, postpartum preeclampsia is a serious condition that can develop within the first 48 to 72 hours after delivery. If you notice dramatic swelling in your face, arms, or legs, or have a severe headache, go to your nearest ER immediately.
These first weeks are an exciting time for you and your new baby, so enjoy your little one. The most important thing is to have confidence in your ability to care for your baby, and know that it's always okay to ask for a little help. Your health and well-being are just as important as your newborn's, so take the time to care for yourself so you can care for your baby.
Just amazing. It's a blessing, and you just can't ask for anything better.
Getting to know them is the best part of having a newborn in the house.
Having her around just makes us our little family.